So, tell me about yourself. You are from?
I'm from Fort McMurray, Alberta, Canada.
Oh,
But I'm actually from Newfoundland.
Look at those nails.
I just broke one. Broke one putting on the
Coffee?
socks.
Give me some coffee, yeah.
Putting on the socks, but
All right. I need my morning coffee. All right. So, what are we doing today?
doing gastric sleeve.
Okay. How'd you? Well, I know how you came up with that, but how'd you decide on a gastric sleeve?
Friends and family talked about it and have gotten the procedure done down here in Mexico.
Most of them here.
Most of them here, yeah.
Yeah. Okay. And I know two of them that are rowdy.
Yes.
And you're already rowdy, so you're just gonna lose weight
And be just like them.
All right. Okay. All right. So here's the explanation of the procedure. We're gonna go in laparoscopically. Laparoscopically means that we're gonna go in with very small incisions. We actually use special tubes, small little tubes that go through the skin into your abdominal cavity. And all right, cool. So we blow up your abdomen. What we do differently is we use specialized instruments that don't hurt the tissue. We spread the muscle. So as soon as we remove the instruments after the surgery, the muscle collapses back into place, just like a needle through a sock, right? A knitting needle. And thus, basically no pain, an extremely quick recovery, and no potential for hernia. All right. Now, what do we do with the skin afterwards? We glue it. So there's no stitches. So these are the things that we know sets us apart from the traditional technique, because we're looking at pain, potential for complication, and then cosmesis, the cosmetic result. So we want it to be beautiful, safe, and effective. So even that has details that we've looked into, because that's why our patients are walking out 2 hours after surgery. And that's why the girls, rave about us, because they said, well, I don't know, they drugged me and I was out, and maybe they took my organs, but I weigh less. No, maybe they don't really grasp the full intensity of or the fine details, but there's certain things we're very precise on, because we want you to have a quick recovery. So we go in there, we perform the sleeve. Now, our sleeve is very unique, and we've been doing it this way for many years now, in the sense that we do a number of things. Number one, we always look at the potential for heartburn. You ever get heartburn?
Yes.
All right, I know. So we're gonna fix your hiatal hernia. We always do that. We always check. And if you read online, a lot of patients that have a sleeve then get heartburn, right? So the idea is that we don't want you with a symptom or an adverse effect after having the benefits of weight loss surgery. So you could get a sleeve, but you don't want to have heartburn for the rest of your life. So what do we do in there? We check the presence of or not of a hiatal hernia. You know what a hiatal hernia is? Basically, we have our diaphragm, which is a flat muscle, and there's a hole where the pipe goes through, which is the esophagus. If the pipe wiggles around because the hole's too big, it's going to pull the stomach up into the chest. That's a hiatal hernia. So what we do is we make a hole smaller, and then we perform the procedure. What do we do differently? We're going to staple. Again, we use high-end, modern stapling devices, single use, none of the cheapo stuff. And then once the staple line is created, we oversew. We bury that staple line. What does that do? That creates a seal, a leak-proof seal, because two seals are better than one. But it also reinforces the procedure, so your friends, they're not gaining weight, they're still losing weight, or they're kind of stable. Why? Because it becomes a very resistant procedure to failure, versus the ones that's some of the quick shops you go around and go shopping for surgery, and suddenly 8 months down the road they start gaining weight again. Why? Well, because it was done quick without reinforcement. Those are the things that we do differently that make the procedure safe, leak-proof, and long-lasting, which is fail-proof. All right? Cool. Questions?
No, my only question was that where I had laparoscopic before, I was hoping you would use the same incision as best you could.
That's a wonderful question. So trying to use the same incisions, but your laparoscopic surgery must have been a lap chole, or what was it?
I well, I got my gallbladder out. So
That's a lap chole, exactly.
Okay.
All right. Well, sorry, that's technical terms.
Tech-
All right. So you had a lap chole, and the incisions, laparoscopic incisions, you were left are in a certain position.
Right.
We're going to try to use them, but because we're facing towards the stomach instead of towards the gallbladder,
Right.
we may be able to use one or two, but typically we can't use them all. Why? Because we need to position our instruments in a perfect angle, and the other procedure was angled towards another area. But that's a good question. The question is, can we use some of the incisions from my previous laparoscopic procedure? We'll try, but we typically can't guarantee, because by now those have changed, they've shifted a little, and of course it was another type of procedure.
Okay.
That's
Perfect.
a great one. Okay, cool.
Good.
All right.